Hi everyone, my name is Katie, and as Arlinda mentioned, I'm the Global Health Security Policy Lead at the Department of Health and Social Care, which we call DHSC because civil servants all love acronyms. So when I talk in this presentation about DHSC, that's what I'm talking about. And today I'm going to be covering 3 key points. So firstly, giving you a sense of the wider context and DHSC's programme of global health security projects. Secondly, talking about DHSC's relationship with the Rapid Support Team and how it was established. And finally, I'll touch on some of the process around deploying the Rapid Support Team. And I'll then hand over to Nikki, who will talk more about research management. So, as most of you will agree, major outbreaks of infectious diseases and other public health emergencies are amongst the most significant threats to any society due to their ability to endanger lives and disrupt public services and the economy. And infectious diseases can emerge and spread rapidly within countries and across international borders, as we've seen in the current pandemic and the recent outbreak of Ebola in DRC. And the UK has a long history of engagement in global health security, and specifically supporting countries, regions, and the international community to prevent, detect, and respond to health threats, including outbreaks of infectious disease and antimicrobial resistance. And as you'd expect, global health security is a high priority in the current context. And when he addressed the UN General Assembly back in September, the Prime Minister announced that the UK would use its G7 presidency to create a new global approach to health security. And he announced a new 5-point plan intended to protect humanity against another pandemic. And the UK's cross-government effort on global health security and antimicrobial resistance is led by DHSC, with strong strategic relationships with the Foreign, Commonwealth and Development Office, FCDO, and other government departments. And supporting low and lower middle income countries to strengthen their ability to address health threats and improve the lives of their populations is a high priority for the UK. And the purpose of our work on health security is twofold. So firstly, to support the achievements of the Sustainable Development Goals, and secondly, to render the global population, including within the UK, safer and more secure from global health threats. So in the last spending review, our global health security team at DHSC was given nearly £500 million of UK official development assistance funding to develop projects in and for low and middle income countries. And you can see the different projects on this slide, including the Rapid Support Team on the left. And this portfolio is delivered with the aims of contributing to a world safe and secure from infectious disease threats and promoting global health as an international security priority. And whilst this portfolio is led by DHSC, we work closely with other government departments, including the FCDO, to ensure we are aligned with each other and to amplify the effects of our work. The legal framework with which the Global Health Security Programme delivers its projects is the 2002 International Development Act. And this permits the UK government to provide development assistance as long as they are satisfied that this is likely to improve the welfare of the population or further sustainable development in the country concerned. So therefore, in delivering the Global Health Security Programme, the team must satisfy the Secretary of State for Health and Social Care, other DHSC ministers and themselves that all projects comply with this act. And to give you some background on how the Rapid Support Team was originally established, as Dan mentioned, the UK government was heavily involved in the response to the Ebola outbreak in West Africa. And as you remember, the outbreak killed more than 11,000 people and exposed weaknesses in epidemic preparedness and response and highlighted failings across the international health emergency response system. And the response to the Ebola crisis and lessons learned prompted a rapid scaling up of activity and spending to address global health threats. And at that same time, there was a move to invest the UK's official development assistance budget more broadly across government departments to draw on the strengths of different departments. And the Rapid Support Team was something that Dame Sally Davis, who is our previous Chief Medical Officer, was instrumental in establishing. And she was a strong advocate of research as a fundamental component of preparedness and response, and was involved in setting the vision of the triple mandate that Dan mentioned, and getting this balance between deployment, research, and capacity building. So Nikki and I make up the Global Health Security Delivery Team, which works closely with the Rapid Support Team. And you can see some of the details of the partnership on this slide. You can see from the slide that day-to-day decision-making lies with Dan, and DHSC are the funder and authority on signing contracts. And finally, there's something to be said very briefly about the process for deployment. And I know that Ashley is talking about this later, so I'll keep it brief. But as a consequence of the Rapid Support Team being a UK government asset, we have a process that brings together government and others in order to deploy the team rapidly, as Dan mentioned. The process has been developed to ensure a robust but agile cross-government mechanism is in place to inform whether the Rapid Support Team should be deployed overseas. And for this, DHSC is the lead responsible government department, and we're involved in all decision-making regarding the deployment of the Rapid Support Team. And we have to secure ministerial approval for deployments for active operations. Deployments of the Rapid Support Team are made on behalf of HMG, either as a bilateral arrangement with a country, as part of wider HMG efforts, or alternatively as part of a deployment coordinated by the World Health Organization through the Global Outbreak Alert and Response Network. And we're keen as a UK government for the team to explore opportunities to do deployments bilaterally in partnership with the country they're deploying to. If they are deploying bilaterally, it's necessary for DHSC and HMG partners to be confident that the request is from the government of the country concerned. So the expectation is that in the majority of cases, the request should come from the Minister of Health or the head of another relevant government department. And where this isn't the case, so for example, the request comes from the Chief Medical Officer, Centre for Disease Control, or another government official, we'll seek advice from in-country HMG colleagues to confirm that the individual making the request has the authority to represent their government. So now that I've given you a whistle-stop tour of firstly, the wider context and DHSC's programme of global health security projects, our relationship with the Rapid Support Team, and finally, some of the process around deploying the team. That brings me to the end of my part of the talk. Thank you very much, and I'll pass on to Nikki now to talk a bit more about the research.
Hi everyone, my name is Nikki. I am part of the Global Health Securities Delivery Team with Katie. As Katie's pointed out, and Dan mentioned and covered quite substantially earlier, UK-PHRST has a triple mandate for deployments, capacity building and research. My role in the delivery team is limited to the research side of this rather than the deployments, but I should add there are usually also inherent capacity building angles to any of the research that the UK-PHRST undertakes. So I'm just going to give you briefly just one slide's bit of information about the research management. So research activities in RST obviously have to be focused on outbreak response. It's the responsibility of the senior managers in the PHRST, that's Dan, the director, and the deputy director for research, to define and deliver an appropriate programme of research, i.e. they're responsible for determining a research strategy, what they're going to cover, why they're going to do that, and how that's going to be managed. That strategy and the yearly implementation plans for the work get agreed by the internal governance structures and governance structures within the department to make sure that we're providing appropriate assurance of alignment to the right policy remit and accountability for the use of the funds. The UK-RST team are continually identifying research needs, ideas or opportunities, either when they're out on deployments or through their wider networks and connections with existing researchers and their existing knowledge and interests. These research needs that they identify have to fit with their strategy and contribute to the overall aims and remit of the RST. They have, over the years, built up a portfolio of discrete research projects covering a wide range of disease areas, outbreak management or outbreak response approaches that are designed to benefit the needs of outbreak response in lower and middle income countries, because this is FDA eligible. As Dan mentioned earlier, there've now been around 20 individual projects, some of which have been completed and some of which still remain active at the moment. And you're likely to hear more about these from the delivery later in the day. Development of the processes that provide the required accountability, assurance, and timely awareness for this kind of work necessitates a very close relationship between us and the Global Health Security Delivery team and the research managers in the RST itself. It's important for us in the delivery team to have timely awareness and knowledge about what kind of activities are being undertaken. And given the fast-paced and reactive nature of the activity being undertaken and the fact that these processes have had to evolve as RST has developed, means that this engagement is potentially a little bit more intensive than you would perhaps expect if you're used to more traditional research grants. And that's largely because UK-PHRST research is not governed by a grant. This is a contract that covers lots of other things. So as a brief sort of example of the kinds of things that we do, the delivery team have monthly meetings with the research managers in the RST, where we talk about new projects that are coming up. We talk about the processes that support governance of those projects. We look at the risks affecting the things that are ongoing. I also attend the technical steering group in an observer capacity, the technical steering group that decide what's great about the science of the project and provide the assurance on that front. And then, of course, UK-PHRST submit to us a series of reports and mandatory reporting requirements on the use of on what they've been doing, progress reports, and on the use of funds that we have to look through, approve, and provide feedback on. So that's what we do in the RST delivery team. That's it from me, I think, unless Katie has anything else to add. We'd be happy to take questions later. I'm afraid I can't stick around for much longer. I have other things I need to do today, but if there are questions Katie can't field, I'm sure she can pass them on.